Hello everyone! Today we'll be discussing the topic of loose implant crowns. Crown delivery is not where the care ends. We need to ensure that our patients understand the importance of care and maintenance for their implant and implant crowns, as they should be on high alert when it becomes loose. Loose implant crowns are not often thought of as a dental emergency per se, but we should educate our patients to consider it at least an urgency, so that they can come see us as soon as possible to address the issues before it gets worse. Let's take a look at a case together. This is Ahmed, and he had an implant crown treatment done a few weeks ago, and he has felt like the bite was off ever since crown delivery. Today, he is on a run for his gains.
Oh, my crown is loose. Should I do something about it? But the marathon finish line is right there. Screw the crown.
Oh, what brings you in today, Ahmed?
So, this that I paid $3,000 for just came off as I was running.
Yeah? And when did it become loose?
It's been a while, maybe like 7 months.
7 months, Ahmed!
But it was fine, I could still eat on it, but suddenly it popped off.
Oh no. Let me tell you what happens when you leave this on for 7 months and it's loose.
When a patient comes in to address their loose implant, we must first identify the etiology. This ensures that we can provide the patient with a long-term solution rather than just a temporary relief. One of the most common and often overlooked etiological factors in loosening of an implant crown is improper occlusal forces. This can be caused by many factors, including high contacts, parafunctional habits, or unbalanced occlusion. These forces can create persistent micromovements and concentration of stress at the crown abutment interface. Over time, this could lead to gradual loosening of the crown, and in some cases may even affect the implant fixture itself. As you saw, Ahmed's implant crown had become so loose that it came off completely, and now we have to assess how severe the situation has become. When an implant crown becomes loose, it is often the abutment screw that has become loose, or even worse, fractured. The abutment screw is the most common site for fracture, as it is the smallest component and a transition zone where the mechanical stress concentrates. Risk of fracture of this component increases with high occlusal forces, excessive cantilever, or too narrow of an implant platform. Returning to Ahmed's case, there is a chance that the abutment screw has fractured and is stuck in the implant fixture. This will require the retrieval of the screw in order to replace the crown. This is typically done by the use of screw retrieval kits. Different implant manufacturers offer screw retrieval kits, so make sure to obtain the one that corresponds to the manufacturer of your patient's implant. These kits typically contain both manual and drill options to cater to the complexity of the fracture. Let's take a look at an alternate scenario if Ahmed had made a different decision.
Oh, my crown is loose. Should I do something about it? V told me I should. Lucky for me, it's right there. So the crown that you made for me for my implant is loose.
Oh, okay, let me take a look. Oh, I see what you're about there. And when did this become loose?
Like just this morning. But I know you guys told me to come in as soon as it's loose, so that's why I'm here.
That's perfect. That's exactly what we want you to do.
Thank you.
As you can see, since Ahmed is having us address the issue early enough, the solution to the issue is simply retorquing the crown back into place. We would first need to take a radiograph to verify the seating of the abutment prior to retorquing the crown back into place. We need to ensure there is no gap between the abutment and the fixture, and if we see a radiolucent line as seen on the right image, there is a gap present indicating that the crown is not seated fully. Torquing the crown back on should be done by checking the manufacturer's guidelines. Usually, the abutment screw is torqued to a value of 30 to 35 newton centimeters using a manual torque wrench. Proper torque will prevent the screw from loosening, prevent micro gap formation, and prosthetic failure. But be careful not to torque too much, as this can cause screw fracture and place stress on the implant and or the bone itself. Thank you so much for watching our video. I hope this video was able to guide you on the management of patients with loose implant crowns.